Hey folks, thank you all for joining us today. We appreciate it. I see a bunch of people still rolling in, so we'll give everybody a minute and before we get started. My name is Liam. I'm one of our senior account executives here, and I'm also our webinar guy, which is what brings me here today. We're going to be going through kind of an interesting topic, which is kind of, you could think of this as like the business impacts of compliance, right? Which is both why it is worthwhile investing in things like compliance and security within your practice from a risk mitigation perspective, but also, let's say, the positive impacts downstream as far as profitability, the ultimate, let's say, even patient outcomes in terms of compliance. Is a lot of layers that we can kind of stack on with this as we go through here today. And so our goal is we want you to kind of come away from the webinar today with some practical takeaways that you could bring back to your companies and hopefully start implementing, right? A few housekeeping items just to start. First, I will say is that all of our webinars are recorded. Generally speaking, on any given webinar, we get like 10 questions of people asking if the webinar is going to be recorded and if they will get access to the slide. So just to answer this right at the beginning, the webinar is recorded. Within a day or two of the conclusion of the webinar, you are going to get an email in your inbox with copies of the slides, as well as a link to the recording. These are all recorded, okay? So I guarantee you, we're still gonna get a bunch of questions of people asking that, but just to get that out of the way ahead of time, yes, you will get the recording and the slides within a day or two at the end of the webinar, okay? Second thing is, if you are interested generally in getting additional free resources for compliance, please check out our website. You can take a look at our blog. We have articles written on pretty much any type of a topic that you can imagine, along with other types of free resources, HIPAA checklists, a lot of those sorts of things. And then the third thing I'm going to say is, please ask questions. As we're going through here today, if there's things that you are curious about, if there are things that you would like to become more familiar with, or if anything that I say is unclear and you want me to kind of unpack some of it further, go ahead and send those questions into the chat box. It would be totally my pleasure to either address it as we go or to be able to tackle it at the end of the webinar. We will have some dedicated time at the end for Q&A, okay? There's a few polls that we wanted to launch really quickly here. And it really related to, let's say, business impacts of compliance. And one of the poll questions that we're going to launch here, you can answer these right up on your screen. Do you believe you've lost a patient or client due to a HIPAA related issue? And this is good information for us to know. I'm seeing a lot of answers roll in. Thank you, everybody. This is really good for us to dig into because it ties in, again, with a lot of the content that we're going to be covering today as far as how you can use compliance to ultimately improve patient outcomes, but also patient experience and satisfaction. And let's see. We'll close the poll. Okay, so 26% of you said, yeah, you think you might have lost a patient due to a HIPAA-related issue, which is interesting. 71% of you said no, and 3% of you said I wouldn't even notice. So depending on the crowd that you're in there, again, it's just good, interesting data for us to have as we're going through here today. And then the other question that we were going to ask is, how willing are you, and let me just go ahead and launch the poll so that you can see it on your screen. How willing are you to invest in software to improve efficiency within your business within the next year? And this is more so in the realm of, let's say that you knew that there was something that you could do to improve business outcomes, efficiency, and profitability, but you have to buy something to make it happen, or you have to put in some effort, right? How would you score yourself on that? We're seeing a bunch more answers come in. All right, we're at like 70% voted, so I'm going to close the poll here. Okay, so 14% of you said very willing. Good on all of you. 70% said I'm considering it. Another 70, that was 70%, and then 17% said not willing at all. And again, really with all of this, what we're trying to highlight is, let's say there is potentially small incremental changes that you can make within your practice that can have a significant business impact at the end of the day. And that's what we're going to be focusing in on today. Again, if you have any questions, feel free to ask them as we go through. I have somebody asking me to turn off the background music. Hopefully that's not on my end. I don't think I have any background music on. You can let me know otherwise. But without further ado here, folks, we can go ahead and dive into the content. To give a quick little bit of background on Compliancy Group. Compliancy Group as a company, we've been around for about 18 years. Our mission statement is that we simplify compliance so you can confidently grow your business. And without giving ourselves too much of a pat on the back, the most important thing I can say is that we have been doing this for 18 years. We've worked with roughly 6,500 practices and organizations all over the country. And in the history of our company, we have never had a client fail any type of a HIPAA audit investigation or be fined, at least not one that was actively subscribed to the program, okay? And so what I'll highlight with that is just purely the things that we're gonna be talking about on the webinar today are things that have been proven to work. And so our primary goal with all of these webinars is that we're able to share some of that wisdom so you can take it back and begin applying it. Right? The general format as far as what you can expect today is we're going to do some general introductions to HIPAA compliance. I know that there are many of you on here that are probably super familiar that don't need the kind of basic overview. We always like to start with that because it can kind of get everybody on the same page on an equal footing. And then we're going to go over common pitfalls across the different stages of practice growth, ranging from small practices to larger organizations. And then we're going to talk about not only the benefits, but the cost as well of non-compliance, depending on what you have set up within your company. We're going to go through some real-world case studies as well. So without further ado, in general, there is kind of a lot of fog and murkiness around HIPAA compliance, especially if you are a smaller practice trying to figure out what is it that you actually need in order to say that you're HIPAA compliant. And so to dispel some of that fog, the highest level requirement of the HIPAA regulations is that you have an effective compliance program in place. This document that you see here on the screen, it's called the 7 Fundamental Elements of an Effective Compliance Program. This comes directly from the Department of Health and Human Services, as well as the Office of Inspector General. And it's what they outline as their boilerplate expectation, not only for HIPAA, but really any compliance program, okay, should be following these 7 core components. The funny thing though, and we're gonna come back to these sorts of individual requirements in just a second, but for most of you, the most important word to highlight here is just this word effective, okay? A lot of people get a little bit screwed up when they're thinking about compliance, really any compliance related topic, because there is so much intentional vagueness in the regulation, and it's so broad that it's often difficult to figure out how this actually applies to you. And one of the funny things, and part of the reason why these regulations are written in a way that is intentionally vague, is because this has to apply to the smallest of single doctor practices all the way up to the largest regional hospital groups and insurance companies in the country. There's no difference in the actual regulation, right? It's the same regulatory requirements that could apply to you as a small practice as it applies to a large company. The government formatted the regulation in a way where it's not just a matter of checking things off of a box and saying that you did it, but rather it's a matter of understanding what can sometimes be broad guidelines, even like what you see here, and implementing them into your practice in a way that is specifically effective for you. And one of the first things to call out here as we're talking about some of these topics is that if things like HIPAA compliance is just like a checkbox for you within the practice, more of a formality, you often miss out on a lot of the benefits of actually having a compliance program, Okay, we're going to come back to this later, but you're not only missing out on the benefits, but you're potentially putting yourself in a much higher risk situation, because the way that the government would audit you if something ever went wrong is based on effectiveness, right? So you have policies. Have they been updated in the last year or two? Can you prove that your employees have reviewed them? You have done a risk assessment, but was it just on your IT systems, or did it include all of the different components of what needs to be in your HIPAA compliance program? Okay, and that's one of the most important things to call out here. For those of you that are so new to compliance and you're not totally sure how you're supposed to go about setting up your compliance program, one of the most foundational requirements of the HIPAA rules is the expectation that you're doing an annual risk assessment, okay? Oftentimes people get mixed up on this because they think of it as a security or a technical risk assessment, and then they only include technical components, when really what's required under HIPAA is an assessment that covers all of the security, privacy, physical site, and administrative requirements of your business as a whole. One of the advantages of doing that full and complete risk assessment is, let's say what you could see here, what we call HIPAA Lite. It doesn't exist, right? There's no such thing really as being mostly compliant or partially compliant. You just either are or you aren't. And part of it is in doing that assessment, if you're struggling to even know where to begin, going through that annual assessment requirement for HIPAA kind of gives you the insight that you need to then know where your gaps are and what might be from an IT perspective, to know what policies and procedures and trainings you need for employees, patient forms, and up-to-date notice of privacy practice, to know what you really need to be tracking and looking at, what vendors you're working with, business associate agreements that need to be in place, how you're handling incidents. All of that contributes to it, but that annual risk assessment is kind of the linchpin, and 70% roughly of all of the HIPAA fines that have ever been levied were due to missing risk assessment documentation, just to really showcase the importance of it. So one key takeaway here as far as HIPAA basics, if you're struggling to set up your compliance program in the practice, or even if you have a compliance program but you have not done a risk assessment in a long time, that is absolutely the first place that I would recommend going to when you get off of the webinar today, is figuring out how you're going to do your risk assessment this year, because that has probably the biggest impact across all of the different areas of the compliance program, okay? Okay, we're gonna get into some pitfalls. I did see a question come in, okay? And again, for those of you that were with us at the very beginning, we did just get a question, would we be able to receive copies of the PowerPoint or recording? And for those who missed it at the beginning, absolutely, yes. You will get a copy, you will get an email in your inbox within a day or two of the conclusion of the webinar. It'll have a link to the recording and copies of the slides, okay? Covered entity pitfalls. Okay, so we're gonna go through a few, let's say across the different sized practices, what are the most common mistakes that people tend to make as it concerns compliance and the impacts of that? And one of the challenges, let's say, especially for very small practices, let's say between 1 and 10 employees, you look at, let's say, even enforcement data from last year. You can see it here, 65% of all of the HIPAA fines in 2022 were levied to very small or solo practices. And what is often causing that is that there's just no formalization around the compliance program, okay? A lot of practices have the equivalent of like an actual physical binder that gets passed around. They might not be doing a risk assessment, at least not one that is complete. When potentially, just over time, they might have a policy manual that they took themselves, that they purchased from their association like 10 years ago and have been trying to keep that up to date. But really the whole landscape of compliance has changed and a lot of it falls behind, okay? And what you wanna generally keep in mind is that in the eyes of the government, if it is not documented, it is not happening, okay? Truly, it does not matter what you are doing in practice. What matters is what you could prove on paper. That is another key takeaway. As you are thinking about compliance, the biggest mistake that you can make is thinking about this in terms of, What am I doing within the practice right now? Get that out of your head as much as you possibly can, because if you're thinking about what you're doing, that will potentially not help you if you were ever audited. What you need to be thinking about is, what do I currently have the ability to prove? How would I respond in the event that the government was auditing me and asking for copies of my risk assessment, asking for specific policies, asking for employee training records? What would that look like for me? Okay, think about it in that line. And if you can create some additional formalization around some of this so that it is clearly documented as well as being operationalized, even within a small practice environment, it's hugely beneficial, because right now small practices are kind of the #1 target for OCR enforcement as far as HIPAA fines are concerned. Okay. Now, as you get into, let's say, kind of more growth stages within practice environments, let's say 10 to 50 employees, you have multiple locations, there are lots of layers that get stacked on top of that, which could be, you have multiple facilities now, which means you have multiple things that you need to be tracking. Okay, the compliance program multiplies because you need risk assessment documentation for each of those facilities. You need to be able to track proof of employee training back to each of those facilities. Incident management requirements as well are often traced back to those individual practices, okay, and the locations themselves. You also have other things like turnover, as well as actual, the actual figuring out of who is responsible for compliance is a big challenge for practices at this stage, because you're at the point where you're getting large enough where if you're the owner of the practice, there is so much on your plate that trying to manage this exclusively yourself is starting to become very, very difficult. Or if you're not the owner of the practice, you might be a practice manager that, again, has tons of things on your plate, and figuring out who is actually handling compliance is sometimes a challenge. And one of the recommendations that we make is usually at this point in time is when you want to begin to kind of delegate some of these things, okay? So if you're the owner, passing some of these things off to a practice manager or an administrative team member, making a very clear role and responsibility around it, not only because it helps you manage things more effectively, but also HIPAA requires it, right? It's a requirement, even of those 7 elements that we were looking at, that you have somebody within the practice, that it's in their job description that they are the compliance officer or privacy or security officer, okay? Doesn't really matter who it is, just that it's documented and that they understand what they're responsible for very, very clearly. And often that is the component that's missing. So we saw a practice that was fined just recently. They had an issue, but ultimately the government found that they didn't have anybody responsible for it within the practice, and that is a requirement of the law. They were fined a lot of money. Okay, so a couple of things to keep in mind there. Now, as you get into much larger practice environments, it becomes even a more difficult question, which is either do we hire somebody that is going to be exclusively responsible for this, or do we outsource some of these functions and continue to manage it just with the people that we have internally? Often this is where risk assessment can get very complicated. Managing employee trainings and policy attestations, especially with employee turnover every year, gets really challenging. And just kind of standardizing everything gets a lot harder. And that's one of the things, and you'll even, you could see this quote here at the bottom. When you're doing this properly as a small practice, all the way up through these different growth stages, it's a whole lot easier to standardize. And even one of the things that we often talk about in that idea of developing a compliance program is that compliance is really what large corporations use to create very standardized experiences for their customers. So even if you think about Starbucks, okay, what has made Starbucks such a huge and reputable brand? Okay, it's not just that they have really good coffee, it's the fact that I can go to my local Starbucks here in New York and order my standard cup of coffee or a latte, and then I can fly to Los Angeles and go to a completely different location on the other side of the country. And not only is the product that I'm receiving going to taste exactly the same, I am going to be receiving a remarkably similar level of customer service, because they have standardized everything within their organization, well-documented policies, robust employee trainings, people that are responsible for it within each of those locations and facilities. And that has caused them to create a very standard experience across an entire country, okay? Creating that same thing in a practice environment is ultimately what's going to make you more profitable, right? So kind of standardizing patient experiences so that each person that walks in your door has the same experience as the person who walks in behind them. If you have multiple locations, same thing. The experience should be the same at one location as it is as another. If you are in an environment where patient retention is really important, like let's say in the context of a dental practice, this is hugely helpful because your patients will actually want to keep coming back to you. If you're not in an environment like that, what it helps with is reputation management, improving online reviews, making sure that people see you, that they hear about you in the communities that you serve as being somebody that is really reputable, right, is what it's all about, okay? Now, we're gonna look at a few case studies here just to showcase one or two things before we get into some more both, let's say, the costs of non-compliance as well as benefits. You could see here, though, general rule of thumb when it comes to compliance, and this is another area where a lot of people get mixed up on, is again, it's all about your documentation, okay? It's not about being bulletproof, but you need to have proof, right, that you're doing what you need to be doing, okay? And so, Banner Health, MedEvolve, Lifetime Healthcare companies, actually all similar in nature when you actually look at what took place within these companies, okay? All three of them had breaches of some kind, okay? All of those breaches were significant, okay, involving thousands of patients, okay? But the funny thing is that nobody in the history of HIPAA compliance has ever been fined for having a breach. A breach can certainly get you on the OCR's radar. It can certainly cause you to be audited, okay? The only reason, though, that somebody ever gets fined by the OCR is because they can't prove that they have some component of an effective compliance program. So you can see all three of these. One of the primary issues identified is that they did not have risk analysis documentation, right? They couldn't prove that they had done a risk assessment across, let's say, every area of the organization. You have others where they were missing things like business associate agreements, which would have been identified if they were doing that risk assessment, okay? The downstream impact of even something as simple as a missing risk assessment is tremendous. And again, this organization that was fined $1.25 million, they could have avoided it just by doing an assessment and addressing the issues that were found, okay? It does not need to be a crazy cumbersome process. It's something that can be pretty simple as far as general risk mitigation strategies here. And some common HIPAA violations, I'm not gonna go through every single one of these just for the sake of time. You could take a screenshot of it, you could read it as I talk. What I will say, though, is that generally speaking, you know, the biggest issue within most companies is human error related. Okay, 86% of all of the breaches that happen throughout the entire country are often as a result of human error. And so even the need for things like risk assessment, it all ties in as well with things like policies, procedures, business associate agreements, employee trainings. The reason all of this is so important is because what the government really expects of you is they want to show that you're mitigating your number one risk, which in actuality is your people and the way that your people are using your technology, okay? If you are able to mitigate those risks effectively, you are the majority of where you need to be as far as HIPAA compliance is concerned, just making sure it's documented effectively. And that human error component is not something that can be overlooked. All right, so benefits of scaling with HIPAA compliance. And let me just double check the Q&A box. And while I do, I'm gonna take a quick sip of water. All right, so what would be considered adequate documentation that somebody is designated as a HIPAA compliance officer? You know, that person's actual job description will vary. I think what matters in the eyes of the government is that you just have something that says that this person is the HIPAA compliance officer. If it's not documented at all is where you can kind of get in trouble. And again, what those responsibilities actually look like is gonna vary. If you are a small practice with 2 employees, it can be very simple. Okay, if you're much larger, it probably needs to be a little bit more robust and more detailed as far as what that person is actually covering on a day-to-day basis, what they're responsible for. And so that's what you want to just take into consideration. Okay. No other questions, so we are going to continue plugging through here. And again, folks, if I say anything that's just not clear, feel free to ask a question. Feel free to call me out. Feel free to challenge me. You have some interesting discussion here at the end, okay? So the funny, let's say within the topic of HIPAA compliance, how can HIPAA help you satisfy your patients and clients? From what we've looked at so far, let's say the general expectation of HIPAA is that you are at least once per year going through a process of assessing and addressing your risks, okay? And a lot of those risks that can often be found are administrative in nature: policies, procedures, trainings, patient forms, documentation. Could also be IT needs and things of that nature. And the beautiful thing, though, about doing this and doing it properly is that it leads to, inevitably, a much more well-run, standardized operational experience for your staff. Everybody is now reading from the same playbook. Everybody is receiving the same trainings. Everybody is expected to follow the same standards, which creates that kind of better service, standardized patient experience, improved loyalty. And ultimately, there's statistically shows that practices that are compliant and secure are on average 15% more profitable than ones that aren't, okay? And there's a lot that goes along with this, which is number one, again, there's a lot of content on these slides. For the sake of time, I'm not going to read everything, but in general, you're just protecting your patient's information, which limits your liability tremendously, okay? So it's not only good for your patients to protect their data, it's really good for you to make sure that you're not liable in the event of some sort of a lawsuit or an issue that occurs, okay? So hugely beneficial on that front. But also better patient outcomes, okay? And let's say not only from a privacy perspective with the actual protecting of their data so that they are not concerned about their privacy being compromised, but also from a patient outcome perspective, if you're improving and standardizing your operations and the service that your patients are receiving consistently across the board, it leads to better patient outcomes and improved service across the board, okay? Creates a culture of patient safety. There's an interesting statistic that says, and this was a survey that was done among people that experienced identity theft. When asked, do you think that your healthcare provider is protecting your medical records the way that they're supposed to? 68% of those people said no. They don't believe that their provider is protecting their records the way that they're supposed to, okay? And what that says to me is, imagine what would happen within your practice if all of your patients felt like you were protecting their data the way that you were supposed to. It is a huge foundational way to build trust, make your patients feel much safer, more secure within your practice environment. And all of that is ultimately a differentiator, right? It's something that you can even choose to market. You know, the practices that often are investing the time, investing the money into more robust compliance and security programs, find that it's something that they're actually able to use to make themselves more marketable, right? If you're fully HIPAA compliant and secure, it's something that you want to tell your patients loudly and proudly, because it improves their perception of you. Reputationally, it differentiates you within the communities that you're serving. And again, it reduces liability. So not only protecting your patients, but protecting you. If you don't have this documentation and something goes wrong, you're in a really tough spot, right? So proof of compliance is really the only way that you're able to limit your liability in the event of a HIPAA or a privacy violation of some kind. Because if you can't prove what you're doing, okay, you don't have a foundation to stand on, and that can put you in a tough position. I'm seeing more questions come through, so let's take a peek. Yes, another question on whether or not the recording and the slides will be available. The answer is yes, absolutely. The recordings and the slides will be available. Does a control framework assessment, NIST or ISO, qualify as a risk analysis? This is a really good question. So for whoever asked this, depending on, it depends on your environment, okay, and it also depends on the NIST of the ISO framework that you're adopting. I will say that the HIPAA security rule is based on the NIST framework of NIST 863. Okay, so if you're looking for the framework itself that you could look up that one. The problem though is things like the privacy rule, the omnibus rule, and the breach notification rules under HIPAA are not going to be referenced under those other security frameworks. And so still doing a full risk analysis for HIPAA, or at least adding on those components to supplement the other things that you're doing in those more technical frameworks, is usually a very good idea. Another question on risk assessment. Would pen testing, vulnerability management programs, and third-party risk assessments qualify as a HIPAA risk analysis? So to really be very, very specific on this, HIPAA does not require vulnerability scans or pen tests. Okay, the components of a HIPAA risk analysis are threefold. It has to include technical assessment, physical site auditing, as well as administrative auditing. Okay, so your technical assessment should cover IT, as well as assets, devices, and applications. Physical site audit is self-explanatory, and then your administrative assessments should cover privacy, security, and breach notification rule requirements. Okay. I work for a small health plan. We have used the OIG HHS risk assessment and other RA formats. Is there a tool that you can recommend to conduct the risk assessment? Yeah, so if you've been using the free one, I'm sure you can relate that there can sometimes be some challenges with that free risk assessment program because it's a lot of manual documentation still. If you're looking for a more automated way to complete your risk assessment, that's exactly what we do, right? So we're kind of like having QuickBooks, but for compliance. If you'd like more information, you could reach out to us at the end. There's a bunch more questions, but we're going to circle back at the end. Okay, so some costs of noncompliance. In general, the #1 impact for most businesses following some type of a data breach is actually not even the lawsuits, not the monetary settlements that could occur with the government. It's usually reputational damage, okay? Breaches that are above 500 patients are actually public record. So you can even Google HHS Wall of Shame and you'll find the OCR breach portal, okay? Commonly called the Wall of Shame. Everything is publicly listed, and what you don't want somebody to see when they Google your practice is the press release and the data concerning the fine that you got because of noncompliance. Okay? It has a downstream ripple effect, diminishes a lot of goodwill. And you could see there was a particular company that had a breach, they were fined, and ultimately years later claimed bankruptcy just because people didn't want to work with them anymore. So let's say on the vendor side of things, 54% of healthcare vendors have experienced a breach, have experienced at least one breach affecting PHI. So if you either are a healthcare vendor, it's worth looking into some of this if you're on this webinar today, but for those of you that are working with different types of software programs within your practice environment, you really want to check on this to determine, and just make sure that you have the documentation that you need to have with all of your vendors, business associate agreements, that you have proof that you've vetted those vendors. All of that is really important because otherwise, even if a vendor of yours has a breach, even if it doesn't originate with you, you could still be held liable. And we've seen this happen. So there's a company by the name of Filefax that was disposing of patient records inappropriately. The government fined Filefax $100,000, but then also there was a particular practice working with them that was fined upwards of $30,000 because they did not have a signed business associate agreement in place. Worth looking into. The average healthcare data breach in 2021 was 9.3 million per incident. Outside IT help to address gaps gets very expensive. Oftentimes following a HIPAA-related incident, there is credit monitoring and identity theft protection that needs to be provided. And in general, all these costs add up, right? So this is taken into account large and small organizations, but just overall, it's not something that you want to have to deal with within your environment. And you can mitigate a lot of this risk just by implementing generally a few basic things, right? So even organizations that had low compliance failures that resulted in a fine, it was 3.35 million as compared to 5.65, right? You could get that down to 0 by doing this properly, right? By making sure that you have everything that you need. And in general, right now, from a breach perspective, one of the biggest risks that most people face is things like phishing scams and ransomware attacks. And the funny thing is that even in the event of ransomware, so 93% of the people that have had a ransomware attack had antivirus and anti-malware. You can go all the way down the line. Only 14% of them were doing employee training on cybersecurity, okay? So the biggest way that you can mitigate your risk of a cyber breach, just in general, is by making sure that your employees are being trained. That's something that you should be doing anyway as part of a HIPAA compliance program. Just to round this all out, some key takeaways. Risk reduction, okay? Implementing an effective compliance program is proven to reduce your risk, whether that's HIPAA fines, data breaches, lawsuits. Maintaining an effective compliance program within your business gives you clear proof of good faith effort, which is what you need to be able to limit your liability. Improving patient experience. A good compliance program standardizes your operations in a way that allows your patients to have a much more consistent experience with you. Makes you more marketable, makes your patients want to work with you, makes them trust you, right? That patient experience ultimately leads to a more profitable practice, right? That not only through operational efficiencies that result in reduced spend, but those better patient experience, meaning that your patients are going to come back to you more. You're going to have better online reviews and a more profitable business at the end of the day. And again, for those of you that are looking into an easier way to do all of this stuff, again, we're a software company. Our platform handles the full gamut. It's a risk assessment tool, handles policies, trainings, the full shebang, everything that you need for compliance in one program. We have modules that are designed for very, very small practices, all the way up to modules and programs designed for large organizations. So if you are interested in learning more, you can see a quick case study here. You could feel free to request information from us online. You can see my information here. You can email me directly as well if you have any feedback on the webinar. But also the other thing that I'll say is just generally, if you have any compliance related questions, you could please email me. And when you close out the webinar today, you will get a quick question asking if you'd like somebody in our team to reach out to you to learn a little bit more about our program. We would love to have a chat with you. Okay. Let's look at some questions. So the question came in, is it a violation for a non-medical person to be viewing a medical record of a resident? For example, a security officer or a food and beverage person being behind the medical cart while the med tech is passing meds. It's not necessarily a violation, but those employees, right, should be trained. So what would be potentially out of compliance is if you have people within your internal environment that you know are going to be seeing patient data, but they haven't been trained and they haven't attested to your HIPAA policies and procedures. That is where it becomes a problem. Okay, so it's not necessarily an issue if they are, let's say, a W-2 employee, they work at that location, they're going to be exposed to things. It's not a violation, but they ought to be trained. Another question, what risks do you see or have seen with providers that are contracted with BAA in place by a hospital for a few hours a week to see patients and have access to the electronic health record system to document patients' progress notes? So covered entity to covered entity, let's say engagements is not necessarily problematic in the eyes of the government, because let's say transmission of patient data is allowable if it's for TPO, treatment, payment operations. Right? So just like you send patient data to your biller with a BAA, or to your revenue cycle management firm, or to the insurance company, right? Or just like you refer patients for the sake of treatment, right? All of that stuff is allowable. It's not necessarily an inherent risk. You just want to make sure that you have those BAAs in place and that you're doing what you're responsible for. Whether or not that contractor or an outside practice is doing what they're responsible for is on them in many ways. Okay. So question, DME supplier, when we visit a home of a patient and it is not a safe and or healthy environment, is it a HIPAA violation to call available services for a wellness check? That is a very good question. What I'm going to do so I'm just taking down your name, whoever asked that question. I'm going to check in with our legal team and just confirm one way or another, what they think about that. I can imagine, you're going to have kind of sticky situations like that come up from time to time, and the regulation is not always black and white on things like that. So I'll find out for you, and we'll get back to you if that's okay. I'm not seeing any more questions, so let me double check. No more questions. All right, so folks, again, if you'd like some information, when you close out the webinar today, it's going to give you the opportunity to just say, hey, I'd like somebody to reach out to me. I'd like to learn more. If you feel more comfortable though, please, you could just send me an email directly. I would be more than happy to chat with you, give you some basic details to see if a service like ours could be a fit for you. But in general, hopefully this gives you some key takeaways that you can begin using within your practice. And then if you ever need help down the road, we are here. All right. Thank you all so much for attending again. We appreciate it.